name is McCurry, and I completed my Ultimate Scholarship Challenge on the topic of lung cancer. First off, I would just like to thank everyone for the opportunity that I had to attend this Congress this past November and the opportunity to complete this competition. At the Congress, I was truly inspired by the three prodigies, Jack Andraka, Brittany Wenger, and Cherie Bowes, and the work that they did with cancer research. They showed me that a medical education isn't required in order to make a true difference in the medical field. Dr. Stephen Palter inspired me to make a non-invasive treatment and surgical processes in order to make it easier on the patient and their recovery time quicker. In regards to my personal inspiration, my grandfather was actually diagnosed with stage 4 lung cancer this past year and has had the diagnosis of lung cancer in general for 6 years. He wasn't given only a year to live, and that's why I really want to help people in conditions similar to his. What exactly is lung cancer? Lung cancer is uncontrollable growth of abnormal cells in the lung tissue, typically in cells lining air passages. These cells divide rapidly and then form tumors. These tumors then resist the lung's ability to supply oxygen to the bloodstream and make respiration extremely difficult. Lung cancer has a very bad prognosis, as it is the #1 killing cancer by far in the United States. Every year, 230,000 new patients are diagnosed with lung cancer, and 160,000 patients die every year in the United States. There's two types of lung cancer, but they're only distinguishable at the microscopic level. There's non-small cell lung cancer, which is here on the right, and there's small cell lung cancer, which is on the left. Non-small cell lung cancer accounts for 80% of cancer patients. There's three types of this cancer specifically: adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. In small cell lung cancer, this accounts for 20% of cancer patients. This type of the cancer is fast growing and spreading, and it typically originates near the chest of the patient. This is the more severe form and the one that has the more deadly prognosis. There's 4 stages of lung cancer, with stage 3 having 2 parts. The first stage of lung cancer is when the tumor is just in one part of the lung, one side. Stage 2 is when the cancer spreads into the lymph nodes on the same side of the lung, which are indicated by the brown shaded ones here. Stage 3A is when the cancer spreads into the lymph nodes that are on the trachea in the center, and then stage B is when it spreads to the other lung, developing tumors, and then the cancer inhabits these lymph nodes. Finally, stage 4 is when the cancer spreads to other parts of the body, such as the stomach or bones. Here's just a picture of the basic airway anatomy. Pay attention to the structure of the trachea, which is right here, and then the main bronchi, which is what will be explained in the next slides in their pertinence to my treatment. In the trachea and the bronchi, there are these cells that are pseudostratified ciliated columnar epithelial cells. Inside these cells, there's these goblet cells, which are right here, that produce mucus, which then trap all the pollutants in the airway and work with the cilia up top to get the mucus up and out of the body and carry all these pollutants out. So, when you smoke or experience other inhaled pollutants, these cells begin to die. So now further pollutants can't get out of the body and begin to settle in the bottom of the lungs, which causes further infection and makes respiratory more difficult and labored. So for my procedure, this is going to have very positive outcomes. It's going to reduce the effects of smoking on the body, it's going to make respiration easier, it's going to lessen the chances of lung cancer and other related diseases, as well as make patients that are already suffering from lung cancer have a more positive life and have less complications. So my procedure involves replacing the necrotic cells, or the dead cells, in the patient's airway with new functioning cells. We're going to insert these cells through the oropharyngeal airway, which is the mouth, and then we're going to eradicate the body of dirty mucus. In order to replace these cells, we have to get new ones. So there's 2 ways we can do this. We can grow them in a lab, or we can collect them from organ donors, as the trachea and the bronchi are not utilized in current organ donations, so we're actually going to be using something that's otherwise going to go to waste. So in order to transplant these cells, we have to get the trachea and the bronchi ready for these new cells. We're going to use laparoscopic surgery, similar to Dr. Stephen Palter, and we're going to go in through the mouth, right here with 2 tubes, and down into the trachea and bronchi. There's going to be one tool that's going to scrape the dead cells off the passageway, and there's going to be one that's going to suction them up and out of the body. We also have to account for the patient's immune system, and it's characteristic that it's going to attack anything foreign to the body, which it considers these new cells foreign. So the patient's going to be administered a drug called Xenopax, which is going to act as an immunosuppressant, which means it's going to weaken this immune system in order to assist the body in accepting these new cells. Xenopax is going to act as an IL-2 receptor through its high affinity bonding due to the great intermolecular forces it has between the ligand and the receptor. The drug is then going to bind to the THC subunit of the IL-2 receptor complex in order to initiate IL-1 bonding, which is make it a successful immunosuppressant. We're going to draw it up and out of the body through suctioning, which is shown here, and then we're going to get the dirty mucus that's deep in the respiratory system up and out through the following methods. The first method is simple in that the patient is going to drink 2 or more quarts of water each day in order to help break up the mucus. The second method is the huff-cough technique. This is something that the patient's going to have to use regularly before they come in for treatment. It's very simple. It involves taking a deep breath, then using their stomach muscles to make 3 baby coughs, followed by diaphragmatic breathing and a final deep cough. This process is going to expel the mucus simply through coughing and get some of the deep in mucus out. The third method is percussion and postural drainage. This is something that the patient is also going to do before they come in for treatment in order to get some of this deep ground mucus out. It involves the patient lying in the recovery position, which is shown here, with their legs slightly elevated. Someone is then going to slightly slap the patient with a cupped hand on their upper rib cage. After that's done on one side, the patient's going to turn over and repeat to the other side. This is going to loosen the mucus in the body up in order to make it easier to be expelled through coughing. The fourth method is the airway clearance device a cappella. A cappella is going to involve this patient sitting in an upright position, taking a deep breath in, and then blowing into the device. When the patient blows into the device, they're going to encounter resistance, which is going to vibrate the mucus in their body and going to make it easier to be expelled when the patient coughs. The method that we're going to use to get these new cells into the body is inhalation through the oropharyngeal airway, or the mouth. They're going to be administered through a metered-dose inhaler, or an MDI, which is shown here. So the composition of the medicine is pretty simple. It's going to involve the suspension, which means it's the mixture of ground particles distributed evenly throughout the liquid, but they don't dissolve. Then you have the propellant, which is responsible to get the medicine to the place that it's designed to go to. In this medicine, it's going to be hydrofluorocline. So there's also a surfactant in the medicine, which is a complex naturally occurring substance which is made of 6 lipids and 4 proteins. The surfactant reduces the high surface tension forces at the air-water interface with the alveoli to reduce the pressure that's required to expand the lungs and make respiration easier. There's also going to be an expectorant, which promotes the secretion of the mucus, which is going to be eucalyptol in this case. So, the treatment process itself is fairly simple. The patient's going to check into the hospital where they're going to be checked in, and then they're going to be administered multiple rounds of the metered-dose inhaler with the new cells. The patient's then going to be monitored for respiratory process increase and advancement, which is where they're going to decide if the patient needs multiple doses, where they will repeat the rounds if necessary. Finally, the advantages to my treatment are simple. The treatment itself is simple. It's non-invasive, which is crucial to cancer patients especially, as well as patients in general. It's going to reduce the risk of infection in the patient and the cancer spreading, as it's minimally invasive. Further, the treatment can treat multiple diseases on top of lung cancer, such as chronic obstructive pulmonary disease, or COPD, and pleural effusion. Thank you for watching my presentation.